Hello everyone, I'm Dr. Abuzari. In this chapter I'm going to talk about cranial nerves and nuclei. In brief, 12 pairs of the cranial nerves. The olfactory, the first one. The nerve of smell. The second one is optic nerve, the nerve of vision. The olfactory and optic nerves arise from the telencephalon and diencephalon respectively, and the remaining cranial nerves originate from the brainstem, with the spinal accessory nerve, the 11th cranial nerves, also arising partially from the cervical spinal cord. Oculomotor, the third one. This nerve innervates the extrinsic muscles of the eye, with two exceptions, superior oblique and lateral rectus, that innervates by the other cranial nerves. The trochlear nerve arises from the dorsal aspect of the midbrain and thus has the longest intracranial length of all cranial nerves. This nerve innervates the superior oblique of eyeball, trigeminal nerve. As you know, some of the cranial nerves are sensory, some of them are motor, but some of them are mixed, like trigeminal nerve. It has a sensory root and a narrow motor root. The sixth one, abducent nerve, that innervates lateral rectus of the eyeball. The seventh one, facial nerve. It is a mixed nerve that innervates facial expression muscles of the face, sublingual and submandibular glands. The seventh one, facial nerve. It's a mixed nerve that innervates facial expression muscles, sublingual and submandibular glands, lacrimal glands. The eighth one, vestibulocochlear. It's about to hearing. Glossopharyngeal. The ninth. The 10th is vagus nerve. The accessory. And finally, hypoglossal nerve. Cranial nerve nuclei. The 7 functional components to which the fibers of a cranial nerve may belong are as follows. Somatic efferent nuclei, oculomotor, trochlear, and abducent nucleus. As I told you before, these 3 cranial nerves goes to the extrinsic muscles of the eye. And finally, hypoglossal nucleus. This nerve innervates the striated muscles of the gloss. A special visceral efferent nuclei. Motor nucleus of trigeminal nerve, motor nucleus of facial nerve, and nucleus ambiguus. The last nucleus is related to 9th, 10th, and 11th cranial nerves. General visceral efferent nuclei. Edinger-Westphal nucleus. It is parasympathetic nucleus of the oculomotor nerve that innervates ciliary and sphincter pupil muscles of the eye. Salivary nuclei or salivatory nuclei. Superior salivatory nucleus is related to the facial nerve that innervates lacrimal, submandibular, and finally sublingual gland. But the inferior salivatory nucleus is related to the 9th cranial nerve, glossopharyngeal, that innervates the parotid gland. Dorsal motor nucleus of vagus. It is parasympathetic nucleus of vagus nerve. For example, that innervates the heart or maybe the lung. general and special visceral afferent nuclei. Nucleus of solitary tract. This nucleus receives general visceral sensations through the vagus and glossopharyngeal nerves. The nucleus plays an important role in reflex control of respiration and cardiovascular function. Fibers of the special visceral afferent carried by 7th, 9th, and 10th cranial nerves and end into the upper part of solitary nucleus, that's sometimes called gustatory nucleus. General somatic afferent nuclei is represented by the sensory nuclei of the trigeminal nerve, main sensory, spinal nucleus, and mesencephalic nucleus of trigeminal nerve. Main sensory nucleus of trigeminal nerve, it is mainly concerned in mediation of proprioceptive impulses, touch and pressure from the region to which trigeminal nerve is distributed. The spinal nucleus of trigeminal nerve, it is concerned mainly with mediation of pain and thermal sensibility. In addition to fibers of trigeminal nerve, the nerve also receives general somatic sensations carried by facial, glossopharyngeal, and vagus nerve. Mesencephalic nucleus of trigeminal nerve. It is the center for jaw jerk. This nucleus receives impulses from muscles of mastication and possibly muscles of eyeballs, face, tongue, and teeth. Special somatic afferent nuclei, cochlear and vestibular nuclei. The vestibulocochlear nerve consists of the vestibular and cochlear nerve, also known as the 8th cranial nerve. Each nerve has distinct nuclei within the brainstem. The vestibular nerve is primarily responsible for maintaining body balance and eye movements, while the cochlear nerve is responsible for hearing. Look at the picture, please. This is the floor of the fourth ventricle from midline to lateral. There are somatic efferent, special visceral efferent, general visceral efferent, general and special visceral afferent, general somatic afferent, and a special somatic afferent. In first column, oculomotor, trochlear, and abducent nerves that innervates extrinsic muscles of the eye, and hypoglossal nucleus that innervates gloss. A special visceral afferent. The 5th and 7th cranial nerves and nucleus ambiguus. The nucleus ambiguus is the common nucleus of the efferent fibers for glossopharyngeal and vagus nerves. The name ambiguous originates from its difficult to find location and variation in different species. The nucleus ambiguus provides fibers that innervate the somatic nucleus of the pharynx, larynx, and soft palate. Additionally, the nucleus ambiguus plays a role in parasympathetic cardiac inhibition through 10th cranial nerve. In general visceral efferent column, Edinger-Westphal, the parasympathetic nucleus of oculomotor nerve, superior and inferior salivatory nucleus, and nucleus of dorsal nucleus of vagus. In general and special visceral afferent, as I told you before, we have solitary tract, general somatic efferent, the sensory nucleus of the trigeminal nerve, and finally vestibulocochlear, oculomotor, trochlear, abducent, and hypoglossal nucleus. Motor nucleus of trigeminal nerve, motor nucleus of facial nerve, This nerve innervates the masticatory muscle. The facial nerve innervates the facial expression muscles. As I told you before, some of the nerves are sensory, some of them are motor, but some of them are mixed. Edinger-Westphal nucleus is parasympathetic nucleus of oculomotor nerve. This is motor nucleus of oculomotor. Trochlear nucleus. This is trigeminal nerve with 3 divisions: ophthalmic, maxillary, and mandibular division. This is abducens nucleus. This is facial motor nucleus. The blue one is dorsal motor vagal nucleus. This is hypoglossal nucleus. Motor nucleus is seen in red in this picture. This is accessory nucleus. This is 10th cranial nerve vagus nucleus. Hypoglossal, the 12th cranial nerve. Vestibulocochlear and facial. Thanks for your attention.